Hey everyone, and welcome to today's Explainer. So, if you're a pharmacy graduate, maybe a practicing pharmacist, or even a healthcare entrepreneur looking to really make your mark, you are absolutely in the right place. Today, we're breaking down the definitive, step-by-step guide to establishing a brand new pharmacy in Pakistan. We're going to take those dense, official, regulatory guidelines and actually transform them into a clear, actionable roadmap. The goal here? To get your doors open legally, safely, and successfully.
You know, countless pharmacy graduates dream of opening their own place, but a surprisingly large number of them just kind of don't know where to start. And honestly, it's completely understandable. The whole world of healthcare regulations can look incredibly intimidating from the outside. I mean, what exact licenses do you actually need? Which authority even approves your pharmacy? And maybe, most importantly, what simple, totally avoidable mistakes could get your hard-earned application rejected right out of the gate? Well, in this explainer, we're going to remove all that guesswork for you.
To make this journey straightforward, we're following a four-phase roadmap. Phase 1 is preparation and premises, Phase 2 is infrastructure and staff, Phase 3 is licensing and inspection, and Phase 4 is long-term compliance.
Okay, let's dive right into this with Phase 1, preparation and premises. Before you even think about forms and fees, you need a physical space to call home. And the first major step is selecting a suitable location. Now, there are specific things the authorities are actually looking for here. Obviously, your pharmacy needs to be in an area where patients can easily access your services. But accessibility is really only half the equation. The premises must be fundamentally clean and secure. You're going to need adequate dedicated space just for medicine storage. And crucially, the location has to protect your inventory from excessive heat, direct sunlight, and moisture. Protecting these medicines from environmental damage is literally just as critical as having a front door that's easy for patients to find. So a good location doesn't just dictate your foot traffic, it significantly impacts your ability to safely store medicines and ultimately the success of the whole shebang.
Once you do find that perfect location, well, you need the paperwork to back it up. Before you can apply for a single pharmacy license, you have to prove absolute possession of the premises. This basically comes down to two options. You either need formal ownership documents or a valid legally binding rental agreement. Make sure you get these sorted out and finalized early on. Why? Because these specific documents are mandatory during the licensing process. Without them, your application basically stops before it even starts.
All right, moving on to Phase 2, infrastructure and staff.
Now that we've secured the physical shell of the pharmacy, it's time to look inward. And here is the single most crucial point. Without a qualified pharmacy, a pharmacy license simply cannot be obtained. No way around it. This is arguably the most important legal requirement in the entire process. You must have a licensed pharmacist who is officially registered with the Pharmacy Council of Pakistan to supervise your facility. It's a strict, non-negotiable mandate.
And let's be super clear about what that pharmacist is actually doing. They aren't just a name on a piece of paper or some figurehead hanging out in the back room. They are the active foundation of patient safety. Their daily responsibilities include the proper dispensing of medicines, active patient counseling, ensuring absolute compliance with all legal requirements, and overseeing the safe storage of all pharmaceuticals. They are, without a doubt, the heartbeat of the operation.
So, alongside your pharmacist, you need to build out the physical infrastructure. And it's not just about throwing some shelves against a wall. The regulations specifically require proper medicine racks, adequate lighting and ventilation, and comprehensive fire safety arrangements. But I really want to focus on a couple of critical items here: a refrigerator and a temperature monitoring system. Why are these so heavily emphasized? Well, you need them to safely store cold chain products. Medicines like vaccines and insulin are highly temperature sensitive. If your infrastructure can't guarantee their exact storage temperature, those medicines become useless or worse, outright dangerous. The physical build-out of your pharmacy is directly tied to the safety of the medicine you sell.
Which brings us to Phase 3, licensing and inspection.
With our premises secured, our pharmacist on board, and our physical infrastructure fully built, we are finally ready to tackle the bureaucracy. It's time to apply for your drug sales license from your relevant provincial health authority and drug control office. You're going to need to compile a very specific bundle of documents. Start with the official application form and, of course, the required fee submission. Next, you need copies of the CNIC and all the professional documents for your registered pharmacist. Then, remember those ownership or tenancy documents we talked about back in Phase 1? Yep, those go in the bundle too. Finally, you need a detailed site plan of your premises. Meticulousness is the name of the game here. Ensure every single document is complete, totally accurate, and cleanly bundled together before you submit it.
And this brilliantly illustrates the actual bureaucratic process. The timeline from here is pretty clear, but keep in mind, you don't just hand in your paperwork and immediately get a license handed back to you. After you apply, you enter a bit of a holding pattern until the official drug inspector visit. If they find any issues, you enter the correction phase, where you literally must fix any identified deficiencies. Only after all those deficiencies are corrected to their absolute satisfaction will you finally reach the approval stage and receive your license.
Let's make this real for a second. Picture this. The drug inspector is walking through your front doors right now, clipboard in hand. What exactly are they looking at? Well, they're verifying the physical presence of your qualified pharmacist. They're heavily scrutinizing your overall storage conditions and specifically checking your refrigeration facilities to ensure those cold chain items are safe. They're also diving deep into your record-keeping arrangements to verify overall compliance with legal requirements. You really need to look at your own pharmacy through the eyes of the inspector long before they ever arrive.
All right, moving to Phase 4, long-term compliance.
Let's say you pass that inspection with flying colors, and the authority officially issues your drug sale license. You can legally start your pharmacy operations. Awesome, right? But it is absolutely vital to understand that receiving your license is not the finish line. In reality, it's just the beginning. A successful pharmacy doesn't just get compliant for inspection day, it continuously complies with regulations every single day. This means strictly adhering to good pharmacy practices. We're talking rigorous daily tasks. You must ensure you're purchasing medicines exclusively from authorized distributors. You have to maintain meticulous purchase records and continuous temperature logs. And you need a systematic way of monitoring and tracking expiry dates to ensure no expired medication ever reaches a patient. Remember, regular inspections can and for sure will occur. Your compliance has to be a permanent state of operations.
I actually want to pause on a quote directly from our source material here, because it serves as the ultimate anchor for everything we've discussed today. A pharmacy is not just a business, it is a healthcare facility. As future pharmacy owners and pharmacists, you must remember that patient safety always comes first. Ethical dispensing, proper patient counseling, and strict regulatory compliance aren't just bureaucratic hurdles. They are the fundamental responsibilities you hold to your community.
So, let's quickly recap the entire journey we've taken today so you can walk away with a firmly cemented mental roadmap. First, you carefully select a suitable location and lock down those property documents. Second, you appoint your qualified pharmacist and build out the essential infrastructure. Third, you submit your complete application, pass the inspector's scrutiny, and obtain your drug sale license. And fourth, you commit to continuous compliance and good pharmacy practices every single day your doors are open. If you follow these steps carefully, you will be firmly on the right path toward establishing a highly successful pharmacy in Pakistan.
Which brings us to the end of our explainer today, but really, it's just the beginning of your deeper dive. Establishing the pharmacy is just step one. To truly thrive, which area of regulation are you going to master next? Will you dive deep into the intricate DRAP regulations, or will you focus entirely on perfecting your good pharmaceutical practices? The world of pharmaceutical business opportunities in Pakistan is vast for those willing to do the work. Thank you so much for joining me today. Keep learning, and I will see you in the next explainer.